Is the goal eventually to, like you said, make New York City the hub and then bang this out on a national level?
Yeah, we're trying to get like we're seeing the response. Like it's going to go live in like a week or two. So you'll be able to buy a membership and then call any one of the providers and they'll be able to say, hey, yeah, these are our rates. So we just have to onboard the actual office staff. So once we onboard all the office staffs from all the other offices, they recognize what this FixCare platform is. Then we roll out the memberships. So New York is definitely beta testing ground point, and then we're going to go on to maybe providers I know in Austin. I'm actually coming out to Chicago on the 31st. Yep, because the Ireland's playing New Zealand in rugby at Soldier Field, so we do a big rugby reunion over there. And but I have I'm meeting with some doctors there, radiologists, physical therapists, and another provider there. So the goal is to kind of like start this in New York, and then big cities like really start to build small medical communities. So the whole impetus is this is like I was sat on my heels on this and wanted to do something like this for years, but then once this CEO tragedy happened, right? Like and it's like, yeah, it's crazy how well-to-do CEO gets gunned down in broad daylight in New York City, and the response on the social media side was like crazy. Like when you support something like that, you're supporting a movement now, and it's like, all right, people had enough. There's no remorse for someone dying, where somebody dying should have some remorse. But this guy's like, basically he's in a position of maximal wealth extraction from people. People had enough, right? So that was the impetus of really starting FixCare and just seeing how people are struggling. And if we can kind of like build this in New York and take it like, on a national level, even international. So there are places in other countries where they're like, we're losing healthcare dollars overseas because saying, hey, I can go to Turkey and get this done, or I can go to, India and get my hip replaced. I can go to Mexico and do it. Like, or you could see these influencers like, oh, you get this whole thing done for like $1,500 and I got everything tech. Well, guess what? You can do that too in the United States at a reasonable number if it's just negotiated correctly with the provider, not having the middleman extracting the numbers, making the value go up. Again, you need like a cuff repair, like we can get that done at a reasonable number. You don't have to go overseas. But if we put the prices up and say, all right, people from overseas see it, and they're like, you know what, I'm going to come to New York and see this like top orthopedist and get this whole surgery done all in, and I don't have to wait on a waiting list in Canada. They're going to come. We just have to make it reasonable for everybody. And even you get like Saudi princes that are like, all right, we're going to go and get the best care. They get overcharged through the wazoo because it's like, oh, it's a Saudi prince. But if we go to like the EUA and we say, okay, like, we go to, there's a lot of Chamber of Commerces trying to talk about business. So we do medical tourism kind of hub where we make New York the hub of medical tourism at a reasonable number. Well, then everybody wins, right? The providers win, the patients win. It's transparent. You're getting billed once. It's like a really good kind of like settlement that we can do. And if you're a small business owner and you're making money, but you need like some kind of surgery done, you could charge that on your credit card. And it's like, because it's a medical expense to keep you healthy, to continue making money, that's a deduction. There's ways to like, reduce your tax burden, not only by buying insurance, but you could use it how you want it, but also paying for it a la carte. And like no one talks about that. And that's why, again, great accountants will tell you like, you could use like 7.5% of your adjusted gross income could be tax deductible. So once you hit those things relative to your income, those are tax deduction. Those are like bigger ticket items. Pay for your physicals, pay for your blood work, pay for your scan here and there for preventative medicine every year. And that'll go forward, that'll pay dividends years over because it'll pick things up early for early detection. You need all that. And then it'll keep from having these big balloon catastrophic injuries. A couple of like terms that they talk about, it's like they always say, oh, save for retirement. Well, nobody ever says save for your health, right?
Uh,
And you could save for your health in two different ways. You could say, oh yeah, save for retirement infers saving for your health. No, it's not. Because everybody hopes that they still can get Medicare at age 65. But guess what? Like that's all going to get bankrupt. So they're going to keep increasing the age to like 68, 70 before people can take that. Invest in your health, meaning do your physicals, do your screening tests, like eat healthy if you can, like find organic foods, keep away from sugar. Sugar is the, like, when they talk about the war on drugs, it should be war on sugar. Sugar is the
yeah.
worst thing, like worst chemical compound in all of us that we can get exposed to. And like do the screening tests, but then it's like now put money aside for your healthcare, but reinvest that in yourself. Use constructs like these medical cost shares and these direct healthcare platforms, and you could hedge that bet, right? So again, being an entrepreneur, being a self-employed individual, small business owner, you're taking risks. So depending on your risk appetite will determine like, yeah, some people don't have that risk appetite, pay for insurance. Pay the increasing premiums. You need it. It'll keep you up at night if you don't. Right, that's your anxiety. But other people's like the anxiety is paying for that. So they're like, well, I'm healthy. Like, what other constructs I can do? And hopefully these constructs that we built fit.